The doctor is in with the latest guidelines regarding lung cancer screening. Who should be screened and when? Dr. Scott Ackerman is one of the First Coast's leading oncologists. He joins us every Friday to talk about the important issues. So let's dive into this one because this is obviously extremely important to your health. So let's talk about the very latest guidelines for lung cancer screenings. What are they?
Thank you, Casey. Yes, there's been some good science over the past few years that have shown that lung cancer screening actually can save lives with lung cancer. We tried for many years to look at different things to do, whether we should get chest x-rays on people or high-risk people, and until recently there really hasn't been any good screening test for lung cancer. But recently we found that, that there is a screening test for certain populations of patients that will help save lives from lung cancer. So the American Cancer Society and the Lung Cancer Alliance have had, a couple years ago, came out with some screening guidelines regarding lung cancer. And now most recently, the U.S. Preventive Services Task Force, which is a governmental agency, now has guidelines which are consistent with the American Cancer Society guidelines. And we think that this could prevent at least 20,000 deaths each year in the United States from lung cancer. And here's the guidelines. The guidelines are that those people that are at high risk, meaning those people that have a 30-pack-year history of smoking and currently smoke or have quit within the past 15 years and are over the age of 55, should have an annual low-dose CT scan. So once a year, they should get a CAT scan of the chest, low-dose CAT scan of the chest, which most of the modern CAT scanners now do. And that will help diagnose cancers early, at such a stage early where we can do surgery or radiation on those and cure their cancer. Now, I mentioned this 30-pack-year history. You might ask, well, what does that mean? It's kind of confusing.
Sure.
So 30-pack-year history just means that if you smoke 1 pack a day for 30 years, that's a 30-pack-year history. If you smoke 2 packs a day for 15 years, that's still the same 30-pack-year history as 3 packs a day would be for 10 years. So a heavy smoker, people that smoke at least a pack a day for 30 years or have this so-called 30-pack-year history and are otherwise healthy, over the age of 55, they should get this annual screening.
What about occasional smokers or non-smokers? Because you often hear about the secondhand smoke. Some people are concerned about that. Should they be screened as well?
Well, we're not recommending screening for people that smoke infrequently or non-smokers, and we don't have good screening for people that receive a lot of secondhand smoke. You know, if you're married to a smoker, we do know that those people that are married to smokers have a higher incidence of lung cancer. But the fact is that in population studies, the risks associated with the low-dose CAT scan, the small risk of harm due to radiation really outweighs any benefits from because we find so few lung cancers in these people. It's unfortunate that we don't have a good safe screening for non-smokers because 1 in 6 people diagnosed with lung cancer are non-smokers.
That's incredible. That's an incredible statistic. Also, you know, with the ACA, the Affordable Health Care Act, being in the news a lot, one of the questions that some people might have is this covered by insurance? Do they still have their insurance? Great
question. Patients ask me that all the time. So the coverage depends on insurance. Some insurers cover this and some do not. If your insurance does not cover low-dose CAT scan, there's facilities in Jacksonville that provide it fairly inexpensively. I've seen prices of $100, $150, those sort of prices. So you know, what's that? 10 packs?
Sure.
20 packs of cigarettes. So you're buying those cigarettes anyway. But under the Affordable Care Act, screenings that are supported and backed by the U.S. Preventive Services Task Force are supposed to be covered. It's mandated within the Affordable Care Act. So hopefully we'll see this mandated coverage for screening for the high-risk individuals come at the end of the year. I've seen in my practice on some patients that I want to get CAT scans on, some of the questions that the insurers ask us before giving us an authorization for CAT scan are questions that are consistent with the guidelines that I mentioned earlier. 30-pack-year history, still smoke, those sort of things.
Okay, and then last but not least, I mean, you're a very well-respected oncologist here on the First Coast. What do you recommend to your patients overall that they should be doing? I mean, other than quitting smoking.
Right.
Yeah, I mean, that would be first and foremost.
So don't smoke, first of all. But if you do smoke, it's very prudent to get screened. So talk to your doctor, engage your physician, But don't use the screening as an excuse to keep smoking.
Yeah,
Right?
yeah. It's like, oh, okay, this one's in the clear. I'll just keep
Yeah,
smoking. What,
right,
you know?
because I could be cured now than
Sure.
the screening test. So don't do that. The best benefit for your health is to prevent lung cancer. The best way to prevent lung cancer is to not smoke.
All right. Dr. Ackerman, thank you so much for
Thank
coming
you,
on, sir.
Casey.
We appreciate you. And thanks so much for sponsoring this segment. If you have any questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook. And his Facebook address is facebook.com/First Coast Oncology.